Alexander, and tonight I'd like to talk about diabetes mellitus with you. Now, the reason why I want to discuss diabetes mellitus with you is because I want to let you guys know what the two different types of diabetes mellitus are, what causes both of them, and also what is the treatment and prevention for at least diabetes mellitus type 2, all right? Now imagine a disease that targets the very way your cells work and provide life to your body. Your body cells require glucose in order to create energy and to sustain life for your body. In order to transfer glucose from your body's blood into the cells so that they create energy, they need a hormone known as insulin. Now, insulin facilitates the transfer of the glucose from the bloodstream to the cells, and also insulin is created from the pancreas, which is an organ within your abdominal cavity. Now, any decrease or deficiency in insulin can result in some severe signs and symptoms, or if your cells are resistant to the uptake of insulin, then those also cause signs and symptoms that coalesce into what is known as diabetes mellitus, because now the cells are starving for glucose, for energy. Next slide, please. Now, a lot of my references that I'll get my information from come from the Medical Diagnostics 2012, and also from the 5-minute clinical consult 2012 20th edition, and Anatomy and Physiology 6th edition, which was written by Thibodeau and Catney. Now, over 20 million people in the United States live with diabetes mellitus, and the ages of these patients range from newborns to the elderly, and that's from the current medical diagnosis and treatment 2012. Now, let us discuss what diabetes mellitus type 1 and type 2 are, what's the difference between the two, and what causes them both. Type 1 is caused by the destruction of cells within your pancreas that produce the insulin. So therefore, your pancreas cannot produce the insulin that is required from your cells to uptake that glucose to produce energy. This is primarily a genetic condition. It's inherited. However, other conditions can cause it, such as illness or fevers from viral infections, but usually those are temporary. Type 2 is more prevalent in the United States, and it results from the cells being resistant to the insulin, so they can't take up the insulin. Therefore, the glucose can't enter the cell, and therefore there's a lot of glucose circulating throughout the bloodstream. And according to the Anatomy and Physiology 6th edition, any increase of blood glucose circulating throughout the bloodstream that can't be taken up, and it's in high amounts, is known as hyperglycemia. Now that we understand what causes the different types of diabetes, let us look at the physical manifestations that can occur with this condition. Next slide, please. For type 1 and type 2 both. Next slide. The signs and symptoms are predominantly the same. There's increased thirst, increased urine output, known as polyuria, and fatigue and type 1, next slide. Fatigue and lethargy. Type 2 is a little bit more severe if left untreated. Next slide. You can get in-organ damage to the eyes, and also damage, destruction to the lower extremities, such as the feet and ankles. Right. Next slide, please. I'd like to show this picture here of diabetic retinopathy. If left untreated, that can lead to blindness. This is very common with type 2 diabetic. Now, also, what can happen with type 2 diabetes would be destruction to the nervous tissue and also the vascular tissue in the lower extremities. Frequent ulcers can occur, and these can get infected a lot, and they become gangrenous, and amputation is usually the course of treatment left untreated. Next slide. All right, now that we know the common signs and symptoms of type 2 diabetes, next slide. This is a severe form of diabetes if left untreated. What it is diabetic ketoacidosis. If your body cells can't burn glucose for energy, then they're going to go and burn muscle and fat tissue in order to produce that energy. And that creates a byproduct known as ketones. Ketones aren't good. If you get a high enough number of them, what can happen is you can have altered mental status, coma, and even death. It's a medical emergency. Next slide. Now, treatment for diabetes type 1 and type 2 both involve daily blood glucose checks. It's a little finger prick, as you see right here. I have that in my office. Type 1 also require daily insulin injections, so that way they can reduce that glucose level inside their bloodstream. Also, they can get a pump installed that gives them the injections as needed. Next slide. Type 2, it's a little easier for them. They don't have to, they still have to get the finger prick every day, but they don't have to get stuck with the needle all the time for the insulin injections. They can take oral medications that help reduce the amount of circulating glucose throughout the blood. Also, they must get foot checks and follow up with the doctor every 2 to 4 months. Next slide. Now, type 2 diabetes can be prevented. Like I said earlier, that it's caused primarily through obesity. So losing 5 to 10% of one's body weight and exercising regularly, and also decreasing a diet that's high in fat and calories can have preventative effects, and that's according to the 5-minute clinical consult. Next slide. So, in summary, diabetes is a disease that affects millions of Americans, and it has the potential to become a devastating disease. However, a lot of people live with this illness, including people that are active duty in the military. As long as they, or you yourself, if you're diagnosed with it, as long as you are staying compliant with the drug treatment and the medication treatments and doing the daily blood glucose checks, then you can go on to live a very healthy lifestyle. Now, thank you very much for your time. That's all I have.